Hi, my name is Parky. I'm a therapist and I received my PhD in clinical psychology in 2024. And today I'll be talking about how can one benefit the most when it comes to going to therapy. So people are often interested in going to therapy, but they don't know what to expect and they don't know how to really make sure that when they do go into therapy, that they can get the most out of it. So today I'll talk about some of the factors that you should consider when you're seeking therapy to make sure that you get the most out of your money and your time. So one of the most important factors that predict treatment outcome is something called the therapeutic alliance, which we can define as the collaborative relationship between you and the therapist. Do you two vibe together? Do you two work together well? And do you trust that the therapist has the expertise to be able to support you and get you closer towards your goal? So when it comes to deciding on a therapist, there's a few different factors that you can consider. One is very subjective. One is just, do I like the person in front of me? Do I think that the person in front of me has my best interests at heart? Do they seem like they really want to work with me? And do they seem to understand my problem? Because it's really important to make sure that you really trust that your therapist understands you and your presenting problem well and seems to have the strategies as well as the training and competence necessary to be able to treat your problem effectively. Like if you're kind of working with low mood or anxiety, does this person seem like they have a really good understanding of mood or anxiety related disorders and are able to deliver competent treatments? And the reason why this is important is because research suggests that there are a few common factors in therapy. And by common factors, I mean that these are ingredients that are common amongst all therapies. Like they're not just specific to cognitive behavioral therapy or dialectical behavior therapy, but they kind of like circumscribe pretty much all types of therapies. So these include positive alliance, so the relationship between you and the therapist, trust, so that you have sort of an expectation that whatever you're doing in the therapy room is actually going to be helpful, and a sense of credibility and competence that you really believe that the therapist can actually deliver that for you. And when it comes to choosing a therapist, a lot of the therapists offer some sort of mini consultation. So they'll speak with you for 10-15 minutes. So during that time, you can get a sense of like, do I really enjoy interacting with this person? Does this person really understand me and my problem? And do they offer me a sense of hope that whatever we do here together is going to lead me towards my goals? And when it comes to the therapeutic alliance, it's not a one-way street. It's not just about the therapist and what they bring to the table, but also what you bring to the table as the patient. And research seems to suggest that these patient-related factors may be actually one of the biggest predictors of treatment outcomes. So you really want to come into therapy with a sort of open, curious eye. So in his book Full Catastrophe Living, Dr. John Kabat-Zinn recounted his experience with working with patients as part of his mindfulness-based interventions. And what he found was quite interesting in that patients who had no expectations of mindfulness, they were like, I don't think this is going to work for me at all, sort of had a self-fulfilling prophecy where they really didn't benefit very much from the mindfulness-based intervention at all. And similarly, on the opposite side of the extreme, the people who were like, I think mindfulness is going to be the thing that solves all my problems, and they think of mindfulness as this panacea that is going to resolve all of their life's issues, also didn't actually have a very good experience with mindfulness and didn't get a lot out of it. And surprisingly, it was the people who were kind of in the middle ground, who were a little bit skeptical as to whether or not mindfulness could be helpful, but willing to give it a shot, being curious as to see what they were going to experience, were the ones who benefited the most from treatment. And this is a good thing because that means you don't have to expect that treatment's going to resolve all your problems. If you came to therapy, you probably likely have some amount of doubts as to whether therapy is going to be useful, and that's totally valid. And one thing that you can do is really try to be open just to see what the therapist has to offer, what the therapy has to offer, and be willing to try out the strategies and theories discussed in the therapy room. Another way to benefit from therapy is to be open and honest with your therapist. Let them know what's working, what's not working. Be willing to be vulnerable with their thoughts and feelings, and trust that the therapist has your best interests at heart. It can often be hard to kind of talk about the things that are vulnerable, fearing about judgment and maybe criticism from the therapist. But in a lot of ways, therapists, if they're worth their salt, are going to have heard everything that under the sun when it comes to all these, things that we think are kind of embarrassing or scary to talk about. So expect that your therapist will truly understand and validate your experience. Be willing to be vulnerable with them, both about your own life and presenting problem, but also with the relationship itself. So tell them what's working, what's not working, and expect that to have that sort of conversation unfold and just see where it goes. And the reason why this is important is because the therapists are experts in the mental health side of things, but you are the expert of your own lived experience, and both are needed to be able to come up with a treatment plan that actually feels like a right good fit for you. So without that information, then the therapist might be kind of going down the wrong path, and you're both going down the wrong path as a result, and then the treatment becomes less effective. So be willing to be open and honest and recognize that the limits to confidentiality and confidentiality itself is going to make it so that no one else is going to know about those things. And there are really few instances where a therapist will hear something and actually have to share it with other people. And this is going to vary by state and by provinces or the regulatory boards, but most of the times they're really only for times where you're at imminent risk of harm to yourself or somebody else, like somebody actually is going to be in danger in terms of their lives. So only in those instances, or in the cases of child abuse, are really the times when you're likely to have to break confidentiality. So everything else is kind of fair game, and your therapist will tell you what are the main things that are these limits to confidentiality very early on in treatments. When I think about treatment progress in therapy, I kind of think of it similar to going to the gym and getting a trainer. So although you'll learn a lot of the skills with your trainer in the gym, most of the work, most of the building of muscle and becoming more fit actually happens during the time in between your sessions, let's say your weekly sessions with the physical therapist or with your trainer, because you're going to be doing these exercises to practice building those muscles and learning and integrating those skills into your life. And the same thing happens in therapy. Although you'll talk about this with your therapist each week, you'll learn new skills and develop more insights. A lot of the actual benefits and work of therapy will happen between sessions. And this is particularly true for more skills-based interventions like cognitive behavioral therapy, where you'll learn skills to work on your thoughts or work on unhelpful behavior patterns and develop these new skills to get you out of certain traps. So one of the things that is important to know is that most of the work will happen in between the sessions. So it's important to be ready to practice these skills even outside of the four walls of therapy. And one other way to really make sure that you're getting the most out of therapy is to understand your why for going to therapy and for making a change. As we know, making a change for any aspect of our life can be really hard. Like the idea of being fit sounds nice in theory, but it might mean changing your habits, your eating habits, your physical activity. It might be giving up some things that you really enjoy for the sake of becoming more fit. And just the same, the idea of facing your anxiety or improving your mood will be very costly in one way, shape, or form. So it's important to understand what your values are. Why is it important for you to make a change? And one question to ask yourself is, what are the pros and cons of making a change? And how do these pros align with my values so that you'll come into treatments feeling very, very motivated and committed to making a change, even when the going gets tough. But the important part is that you don't have to do all of this alone. It's important to recognize that you and your therapist are going to be working together to clarify your whys, to set up the goals, and find a treatment plan that actually feels right for you to move towards success. So you don't have to take ownership of everything and be like, I have to be like totally ready before I go to therapy. In fact, you can kind of go in with an open, curious eye of like, I don't really know what is going to happen, so I'm just going to follow the lead of the therapist, and together we can come up with a plan that feels right. So no need to take all of the work for yourself, and just come in, however you are. So remember that you don't have to be fully committed to therapy or know all the answers before starting therapy. Come on in, have a chat with your therapist or potential therapist and see if this feels like a good fit for you. And one additional thing that I'll encourage you to do is to really ask the therapist about the types of services they provide and whether or not it is evidence-based, meaning that is it backed by the science. And there's a lot of different treatment modalities that have empirical support, like cognitive behavioral therapy, acceptance and commitment therapy, psychodynamic therapies. All of these will have some body of literature to suggest that what you're doing is actually supported by the science. So you don't want to necessarily go into therapy, especially if you're dealing with a certain mental health disorder and the therapist doesn't really know exactly what type of modality they're providing you, because if it's not supported by the literature and it doesn't seem like it has at least a key theoretical mechanism as to why it would help with anxiety or with low mood or with insomnia, then you might want to take a step back just to figure out whether or not this is a good treatment for you. Anyway, I hope this video was helpful for understanding a little bit more about the therapy process and how to get the most out of therapy. If you are deciding to start therapy, remember that it's not a commitment to just have a conversation. Many therapists will offer some amount of consultation just so that you get a sense of whether this feels like a good fit for you before you decide to take a larger step. If you enjoyed this video, I encourage you to subscribe because I'll be continuing to make more videos about therapy and as well as evidence-based mental health down the road. Bye-bye.